Hey y'all, welcome back to Art Science Wonder. It's been a while, I know, but it is difficult, let me tell you, to become a content creator. It's a lot harder than it looks. So lots of troubleshooting and things lately that have been kind of keeping me from being able to post. I can't even get my camera to work live. It's a long mess. I'll tell you more about it later. For now, I just want to tell you that I am going to be starting 2 new podcasts. One for Art Science Wonder, which is going to be really general and broad. There's basically going to be no topic that is off the table for Art Science Wonder. But for Radical Science News, which has been my project for 5+ years, that's going to stay the same. That's going to be really hard science, very strict in its content. So as of right now, I'm just going to be putting this on a playlist, Radical Science News, on our YouTube, on both of our YouTubes, Art Science Wonder and Radical Science News. And we're going to be doing a podcast that basically is going to be going over science news. So it's kind of for people who are, many of us are busy, like me. I'm doing a million things at once. I'm constantly multitasking, constantly learning so many new things. So, when you're cleaning the kitchen or you're having to do some chore, now you can look or listen to my podcast on any of the podcast sites that I put this on, which is probably, if you're listening, on one of the podcasts websites right now, as there are many. So, but if you really want to find my content and you want to know a surefire place to find it, I will always be on YouTube as Art Science Wonder and Radical Science News. So there you go, super easy. So just to let you know, we're going to be doing news from the last few days today. Sometimes it might be, the science news for the week, or even science news as far back as a few months ago. But I'll make sure to always tell you the dates that the news, the paper, the journal, whatever it happens to be, was published. That way you can always know and stay up to date with science. And if you miss something, you'll get to go back and, hear what you missed. So hope you guys enjoy. This one is from a couple days ago, May 13th, 2020. This was released at 10:11 p.m. And this is from International Business Times. So as a journalist, I just want to give a little disclaimer here, sort of. I'm looking for something very, very particular for my articles, at least for Art Science Wonder, which is going to be a little bit more loose, less strict than Radical Science. I'm more looking for a quality in the article, something that flows, something that's easily digestible, but also based in facts. So before I read any of these articles, I make sure to read other articles like them, or other, papers like them, to kind of cross-reference and see who kind of had the better writing style, or the style maybe that I might just particularly prefer. So anyways, I hope you guys enjoy these podcasts. They should be pretty fun, and hopefully I don't put you to sleep. I'm trying to prevent that. I'm actually trying to help everybody learn, so I don't want to put you to sleep. So this one is, again, May 13th, and it's SpaceX Demo 2. Astronauts enter pre-flight quarantine ahead of historic mission. Okay. 2 NASA astronauts, Robert Behnken and Doug Hurley, have entered routine quarantine ahead of the upcoming historic mission to the International Space Station, in other words, the ISS, With or without the pandemic, astronauts undergo the quarantine procedure to prevent the spread of contagious illnesses. It will be the first time a SpaceX spacecraft will transport NASA astronauts, and the first time in almost a decade that American astronauts will launch from the United States to the ISS aboard an American spacecraft. Since the space shuttle program ended in 2011, American astronauts have had to hitch a ride from the Russian Soyuz spacecraft to get to the space station. With just 2 weeks away from the SpaceX Demo 2 mission launch May 27th, oh my god, it's coming up, astronauts Benkin and Hurley entered routine quarantine on Wednesday. Although the quarantine seems fitting for the current global situation with the coronavirus pandemic, astronaut quarantine, or flight crew health stabilization, in other words, is actually a standard practice for the crew in the weeks before all missions to the ISS. And that makes sense, right, guys? You don't want to be taking crazy diseases to the moon or Mars, right? Especially if we're going to colonize them one day. So this makes a lot of scientific sense, and I'm really glad to hear they were doing this previously. So this routine is done to make sure that the astronauts are healthy and will not accidentally carry the contagious disease to the ISS, a practice that's particularly significant because of the pandemic. Spending the final 2 weeks before liftoff in quarantine helps ensure the Demo 2 crew arrives healthily, protecting themselves and their colleagues already on the station, NASA said in a statement. So guys, I might not always be accurate. I might make little mistakes like that. I'll also give my commentaries sometimes, and I hope that you guys enjoy them and can forgive the little mistakes. Typically pre-flight quarantines for astronauts taking off from, and here's a name, okay? I might mess up names too, just so that you guys are prepared. So Kazakhstan are done near the launch site, but for the Demo 2 mission, astronauts have two choices. If they can maintain quarantine conditions at home, they can stay there until they travel to Kennedy Space Center on May 20th. If for some reason their homes cannot maintain quarantine conditions, they can choose to stay at the astronaut quarantine facility at Johnson Space Center until they report to the Kennedy Space Center. Given the coronavirus pandemic, there are additional measures in place for this quarantine. For instance, anyone who has to interact with the astronauts during the quarantine will have their temperatures and symptoms tested. Both astronauts, as well as those in direct contact with them, will also be tested for the coronavirus twice. Okay, and then you see SpaceX Crew Dragon Demo 2 could be the first private spacecraft to bring humans to space. Pictured SpaceX CEO and chief designer, yada yada. Love speaks with NASA astronauts who are assigned to fly on the Crew Demo 2 mission after launch of a SpaceX Falcon 9 rocket carrying the company's Crew Dragon spacecraft on the Demo 1 mission. From Firing Room 4 of the Launch Control Center, March 2nd, 2019, at the Kennedy Space Center in Florida. So if things go according to plan, Benkin and Hurley will embark on a historic mission wherein they will lift off aboard the SpaceX Dragon crew from Kennedy Space Center at 4:33 p.m. ET on May 27th. Wow, guys, it's so soon. I'm really excited. This is huge news for space science. And it's just really hoping everything goes right with this, of course, because, you know, this is a crew. Again, many things can go wrong. Rockets are very combustible. So, you know, wishing them the best of luck, and very excited for this and looking forward to eventually going to the moon again. Okay, so on this topic, some interesting things have happened recently as well. And it happens to be on May 13th that this was released. Chinese rocket debris passed over New York City and LA as it fell to Earth, scientists say. Woo, scary. And this is from Yahoo News. But it is well written, so I'm going to keep it, and this is the one I chose. So anyway, a 20-ton piece of Chinese rocket passed over New York City and Los Angeles before it crashed into Earth this week, scientists tracking its descent say. The debris, which came from a rocket that was launched in early May, is the 5th largest piece of space junk to plunge uncontrolled through Earth's atmosphere, according to experts who tracked space debris and satellites. It's the largest object in nearly 3 decades to plunge to Earth unexpectedly, demonstrating the potential danger of such large objects as they make uncontrolled re-entries from low Earth orbit. The U.S. Space Force's 18th Space Control Squadron, which tracks space junk and re-entries from Vandenberg Air Force Base in California, confirmed that the rocket stage passed through Earth's atmosphere Monday at 11:33 a.m. Eastern Time as it was flying over the Atlantic Ocean. About 15 to 20 minutes before that, the debris sailed over New York City, according to Jonathan McDowell, an astronomer at the Harvard Smithsonian Center for Astrophysics. On its last orbit of the Earth, the rocket stage happened to pass directly over Los Angeles and New York City. It's just a strange coincidence that it happened to fly over 2 major urban areas on its last orbit, and if it had come down earlier, there would have been some drama. Oh man. The dangers of rockets. China launched the Long March 5B rocket on May 5th as part of an uncrewed test flight of a new crew capsule. In low Earth orbit, the rocket stage would have been traveling at roughly 18,000 miles per hour, but friction would have significantly slowed the debris as it made the fiery journey through the atmosphere. McDowell estimates that any pieces that don't burn up would hit the ground at 100 miles per hour. It wouldn't be enough to wipe out New York, he said. It might take out a floor of a building, but either way, that is still more than we need right now. So I actually gathered 2 articles for this because the next one for my YouTubers has a graphic of the orbit that the rocket took, and it shows why and where. So the next one is from Forbes, and it's called Chinese Rocket Debris May Have Fallen on Villages in the Ivory Coast after an uncontrolled re-entry. So the Ivory Coast is kind of on the southwestern not bottom, but like on the edge of Africa. And you can look it up. It's an interesting region, actually. So according to the reports, debris from Chinese rocket launched a week ago has fallen onto at least 2 villages in the Ivory Coast, following an uncontrolled re-entry of the rocket's core stage. On Tuesday, May 5th, China's Long March 5B launched from the Wenchang Space Launch Center in the Hainan province in South China. On board was an experimental crew capsule designed to one day take humans to space and perhaps to the surface of the moon. The uncrewed spacecraft raised its orbit. Sorry, my website moved. Raised its orbit up to about 8,000 kilometers before performing a high-speed re-entry and landing back on Earth. A similar demonstration mission to NASA's Exploration Flight Test 1 (EFT-1) of its Orion spacecraft back in 2014. However, shortly after the launch, it emerged that the empty core stage of the rocket weighed in at nearly 18 tons, would perform an uncontrolled re-entry. This would make it the largest object to do so since the Soviet Union's Salyut 7 space station in 1991, weighing 39 tons. Man, rockets are so heavy. They're really cool, though. Let's see. So, if you're watching on YouTube, you can see the orbit here. A Dr. Marco Lang, I can't pronounce his name. We are entering the Z5B re-entry window, which is approximately this track. Position is 4, and then it gives position stuff, and it shows kind of how the orbit of the rocket happens to go across all the way across North America and toward the kind of western edge of Africa. And so it makes sense that the debris were seen all the way from the west coast to the west of Africa. And it's pretty interesting I actually was in a space startup for a little while, and that was really fun. I learned so much about, rocket orbits and everything. I mean, you can imagine, but anyway, so it says the orbital path of the core stage took it over the Atlantic Ocean with a small possibility that it could break apart on re-entry and rain debris on the United States. However, the U.S. Air Force later said that it had re-entered over the Atlantic Ocean. Okay, that was yesterday, Monday, May 11th. But reports have now started to come in that some of the debris reached the Ivory Coast. Pictures posted on social media showed that what appeared to be a 12-meter long pipe originating from the rocket that had landed on the ground, which possibly originally measured about 21 meters long, but may have broken in half on re-entry. Man, that is a crazy long pipe. So, I concluded that the objects seen in Mahono, and the least some of the other objects from the I can't even pronounce that region, guys, whose photos are being circulated in Africa media are very likely parts of the Chinese rocket stage. Anyway, I see so much hilarity in this. It's a little bit dangerous as well, but it was actually kind of fun to learn about and see the pictures. So definitely look that up if you guys get a chance. And I have a picture of the Ivory Coast here as well. So speaking of more atmospheric things and atmospheric disturbances, a very small bit of news, but slightly interesting bit of news about hurricanes. And how hurricanes are formed. Apparently, hurricanes are much more easily formed than we think. And it doesn't take all that much, really, to make an atmospheric disturbance large enough for a hurricane to form. But we're still learning a lot more. So, news-wise, you've probably seen the satellite images that show a hurricane developing. Thick white clouds clumping together, arms spinning around, and a center eye as it heads for a coast. And this is from May 13th again, from Florida State University and newswise.com. After decades of research, meteorologists still have questions about how hurricanes develop. Now, Florida State University researchers have found that even the smallest changes in atmospheric conditions could trigger a hurricane, information that helps scientists understand the process that lead to these devastating storms. The whole motivation for this paper was that we still don't have that universal theoretical understanding of exactly how tropical cyclones form. And to really be able to forecast that storm by storm, it would help us to have that more solidly taken care of. Anyway, this is a slightly longer article and it goes on, but that was the gist of that article. The next article is also kind of about climate or weather. But in this case, it's definitely a long-term thing. So it's climate instead of weather. One third of humans could live in hottest Sahara conditions by 2070, study says. And this is from worldnewsupi.com from May 13th as well. There's a picture and it says a dust storm from the Sahara Desert is caught on camera from the International Space Station. File courtesy of NASA. May 13th, UPI. The World Economic Forum warned Wednesday that 1/3 of the world's population could be living in locations as hot as the Sahara Desert in the next 50 years if world leaders don't take decisive action on climate change. The WEF's findings are based on the research of a team of scientists who studied global temperatures over the past 6,000 years. Their research was published in the Proceedings of the National Academy of Sciences earlier this month. The organization said that most humans live within a narrow band of environmental conditions on Earth, but rising global temperatures could threaten those conditions. The WEF senior writer Sean Fleming noted that this band of climatic fluctuations has an average annual temperature of 55.3 degrees Fahrenheit, and the crops, livestock, and irrigation that are on the bedrock of the planet's food production system were developed, discovered, and designed within those constraints. He wrote in a blog post. These critical systems, Fleming said, can't operate normally outside those normal environmental conditions, like those in the hottest part of the Sahara Desert in northern Africa. Those hottest parts of the desert in northern Africa account for less than 1% of the Earth's land surface. But those conditions will spread to about 20% of the land surface if global warming is left unchecked. The study also noted that by 2070, population growth is expected to be greatest in already hot locations on Earth. The areas hardest hit by the rising temperatures will be Africa, South America, and Australia. Oxfam has said that climate-fueled natural disasters have pushed more than 20 million per year out of their homes over the past decade. Mass migration could increase the burden on host countries. This study underscores why a holistic approach to tackling climate change that includes adapting to its impacts, addressing social issues, building governance, and empowering development, as well as compassionate legal pathways for those whose homes are affected is crucial to ensuring a world in which all humans can live with dignity, said Martin Scheffer, a professor at Wageningen University who coordinated the research. Anyway, interesting stuff there on climate. And then a kind of cool new finding here. This one was published on Inverse. Compound found in medicinal fungus can rapidly reset the body clock. So this is for those people who are travelers who maybe are like me and who tend to never be able to work a normal job because their circadian rhythm is a little bit longer than most people's. So they're constantly switching their schedule, or someone who works the night shift. This could be very, very useful for many, many, many people. This fungus is a compound, or is a medicinal fungus that's already used medicinally. And it says, in the future, people getting ready for a flight and fearing implementing jet lag might fit an assortment of additions into their carry-on, masks, gloves, and maybe a medicinal mushroom hailed for delivering silly stuff. Anyway, that's because a new study, and there are other studies, but for some reason Inverse was the only one who seemed to write about this. But anyway, that's because a new study suggests that a synthetic form of cordyceps, a compound found in medicinal fungus with a reputation for keeping bedroom doors closed, may help ease the pain of jet lag. I like the second paragraph there. That was a better, a more appropriate way to say that, I guess. Cordyceps is the active ingredient in a fungus called C. militaris. This fungus gets its sexy reputation because it's similar to a rare fungus called C. sinensis, which is found protruding from the corpse of dead caterpillars high in the Tibetan Himalayas. The difference is that C. militaris is much cheaper and in turn much easier to get. C. sinensis has memorably been described as Himalayan Viagra and sells for about $35,000 per pound in China. Geez. In the study, a synthetic form of cordyceps was evaluated to see if it could be curative for something else, jet lag. The results were positive. In mice, scientists found that the synthetic cordycepin drastically helped the animals adjust to time change. Normally, when mice are exposed to an 8-hour time change, imagine flying from New York to Abu Dhabi. It would take them 10 days to adjust. The mice on the cordyceps took only 4 days. And that's a big deal. Jet lag seems to do a lot of harm to the body. And in general, lack of sleep does as well. So, Irakan Zhang, the study's senior author and an assistant investigator at the National Institute of Sciences in Beijing, tells Inverse that these results suggested that cordyceps can help reset your circadian rhythm. That's the cycle of hormone release that governs our sleep and wake cycles, as well as other processes. It's also known as a biological clock and the body clock. Interesting. See, this makes me wonder if it might have some implications in longevity science. I would be very interested to see if it ends up being that way. So we want to let people know that drastic and quick changes for our body clock are possible, Zhang says. The study was published Wednesday in the Science Translational Medicine. Very cool. Anyway, that's a kind of long article, so we're going to go to the next one, which is very interesting as well. This is also from May 13th by Medical Express. I like this website a lot. They do a lot of hard medicine and science, so I follow them pretty regularly. Okay, so it's called Researchers Discover How HIV Hides from Treatment. Now, a lot of people are talking about HIV viruses or circular shaped viruses and because of COVID-19. So I think it's interesting for us to all learn more about viruses in general during this time. And since coronavirus has been somewhat compared to HIV in a lot of different, medical articles, it's not the same, obviously, but it has, one commonality, which is its general shape, and maybe how somewhat it enters the body as well. So HIV yellow, infecting a human cell. Even after successful antiretroviral therapy, HIV can hide dormant in a tiny number of immune system cells for decades and reemerge to threaten the life of its host. Now, Yale University researchers have discovered a molecular explanation for how the virus accomplishes this insidious trick. They report May 13th in the Journal of Science Translational Medicine. Long-living CD4 T cells, which act as the immune system's memory of past infections, are HIV's safe harbor. The virus actually intertwines itself in the DNA of T cells, but because the virus is inactive, it leaves nothing to mark its location. HIV integrates itself into the human DNA, so that antiviral therapy, cannot find and kill it, said senior author Yachi Hu, assistant professor of microbial pathogenesis and medicine. Oh, I'm pretty sure I definitely said that name wrong. I've been learning some Mandarin and that was pretty terrible. I apologize. So it is very hard to study these cells. Only 1 in a million CD4 T cells have infectious HIV, said Ho. They are like dandelions, hidden in a lawn, impossible to find in the grass, but can suddenly pop out as yellow flowers. That's a very pretty way for her to say that. It's very metaphorical. It's very very beautiful way to talk about a very deadly and terrible virus, but I commend her for that. So the Yale team developed a way to find these hidden infected cells and also a potential way to control viral spread. Ho's team took cells from HIV patients who had undergone antiretroviral therapy. The scientists activated the virus in T cells in a lab dish and used fluorescent probes to label the viral RNA that identifies infected cells. They then removed these rare HIV-infected cells and studied individual cells at high resolution. This method, called HIV sort-seq, allowed researchers to track the interplay between the RNA and the host and the virus within single cells. So here's her, there's a video here discussing the main idea. with her dandelion metaphor. And then they found that HIV essentially hijacks genes that allow T cells to survive. Intriguingly, said the researchers, HIV works to promote the expression of genes implicated in cancer. Interesting. Okay. I'm going to pause here and kind of interject here. This is very interesting to me because I will be doing a very long and in-depth, but hopefully eye-opening video on viruses and their kind of links in cancer. There's a lot to be said there. Anyway, essentially HIV wrests control of activation of these cancer genes from the host cell. Although this process does not cause cancer in T cells, the researchers said the process may help these HIV harboring T cells to proliferate. Very interesting. Understanding these processes could help scientists develop new ways to control HIV infection, the researcher says. So there was that. Very interesting. Okay, and then the next one is also from Medical Express. In this one, it says, study confirms that cats can become infected and may transmit COVID-19 to other cats. Okay, so we're not saying it necessarily will infect humans. I was a little bit wary about maybe talking about this one, but hopefully all my listeners are very intelligent and they're not going to go start killing cats. Okay, so anyway, this is something I have been wondering about since the pandemic was kind of early on, because one of the transmission species that we thought maybe this particular coronavirus had infected was the pangolin, and after doing some research I realized the pangolin was related to closely related to dogs and in particular cats. So it made me worry that maybe our pets can get infected, and there were some people who were really shaming that idea. No, our pets can't get infected, but turns out maybe they can. So in a study published today, May 13th, so back in on the 13th, in the New England Journal of Medicine, from Medical Express here, scientists in the US and Japan report that in the laboratory, cats can readily become infected with SARS-CoV-2. So that's another name for COVID-19. The virus that causes COVID-19, and may be able to pass the virus to other cats. Professor of pathobiological scientists at the University of Wisconsin School of Veterinary Medicine, Yoshihiro Kawaoka, led the study in which researchers administered to 3 cats SARS-CoV-2, isolated from a human patient. The following day, the researchers swabbed the nasal passages of the cats and were able to detect the virus in the 2 of the animals. Hope I'm not putting you guys to sleep. I'm getting tired. It's getting late. Within 3 days, they detected the virus in all of the cats. Oh man, that's a concern for certain. The day after the researchers administered virus to the first 3 cats, they placed another cat in each of their cages. Researchers did not administer SARS-CoV-2 virus to these cats. Each day, the researchers took nasal and rectal swabs from all 6 cats to assess them for the presence of the virus. Within 2 days, one of the previously uninfected cats was shedding virus, detected in the nasal swab, and within 6 days, all of the cats were shedding virus. None of the rectal swabs contained virus. Okay, so you can't get it from their poop. All right, so just don't let a cat sneeze on you if it's got coronavirus. I'm just kidding, guys. I don't know. But anyway, each cat shed SARS-CoV-2 from their nasal passages for up to 6 days. The virus was not lethal, and none of the cats showed signs of illness. All the cats ultimately cleared the virus. So that's good news for cats, guys. That's pretty good news. That at least they were okay. But this again might say that this has become a truly global virus. Cats can get certain types of colds, I believe. They get their own version of colds and the flu. So, possibly it will stay within their own populations. Hopefully it won't mutate and get worse for them and cause them severe illness the way it does for us. And hopefully it doesn't become zoonotic between them and us. But, if it does look like coronavirus is not going to be going away for a very, very long time. And the only way to achieve effective herd immunity is through a vaccine. So, much better than, like, say, if you were to get the measles and you didn't get vaccinated, your chances of surviving are many times lower. So if you're afraid of needles, don't worry. They're coming out with vaccines that don't require needles. And there are already vaccines today, if you didn't know, that are actually nasal sprays. So we'll talk more about vaccines here in a little bit. So let's see, where's the rest of this? Okay, that was a major finding for us. The cats did not have symptoms, said Kawaoka, who also holds a facility appointment in the University of Tokyo, guys. Man, it's getting late. Sorry. Kawaoka is also helping lead an effort to create human COVID-19 vaccine called Coroflu. So, the findings suggested cats may be capable of becoming infected with the virus, then exposed to people or other cats, when exposed to people or other cats positive for SARS-CoV-2. It follows a study published in Science by the scientists at the Chinese Academy of Agricultural Sciences that also showed that cats and ferrets could become infected with and potentially transmit the virus. The virus is known to be transmitted in humans through a contact with respiratory droplets and saliva. Oh man, not good news, huh? It's something for people to keep in mind, says Peter Halfman, a research professor at UW-Madison who helped lead the study. If they're quarantined in their house and are worried about passing COVID-19 to children and spouses, they should also worry about giving it to their animals. Pretty prolific for a virus, is it not? Both researchers advised the people with symptoms with COVID-19 avoid contact with cats. They also advised cat owners to keep their pets indoors in order to limit the contact their cats have with other people and other animals. Kawaoka is concerned about the welfare of animals. The World Health Organization for Animal Health and Centers for Disease Control and Prevention say there is no justification in taking measures against companion animals that may compromise their welfare. So please do not start automatically fearing your cat. Please don't treat them badly because they could get COVID-19 from you. Please keep them indoors just like you're doing for yourself. The same kind of deal. Okay, guys? So anyway, humans remain the biggest risk to other humans in transmitting the virus. There's no evidence cats readily transmit the virus to humans, nor are there documented cases in which humans have become ill with COVID-19 because of contact with cats. So that's also a good thing. Using common sense, using appropriate handling, even for vets and, shelters, that would make a lot of sense here. And there are, however, confirmed cases or instances of cats becoming infected because of close contact with humans infected with the virus. So, and several large cats at the Bronx Zoo have also tested positive for the virus. For instance, according to an April 22nd announcement from the U.S. Department of Agriculture, 2 cats in 2 private homes in New York State tested positive for COVID-19. One had been in a home with a person with a confirmed case of the viral disease. The cats showed mild signs of respiratory illness and were expected to make full recovery. Additional cats have also tested positive for COVID-19 after close contact with their human companions, says Sandra Newberry, director of the the UW-Madison Shelter Medicine Program. Newberry is leading a research study in several states in the United States to test animal shelter cats that might have previously been exposed to COVID-19 cases. Animal welfare organizations are working very hard in this crisis to maintain the human-animal bond and help pets with their people, says Newberry. It's a stressful time for everybody, and now more than ever, people need the comfort and support that pets provide. All right, let's go ahead and look at the next one. Okay, the next one is from Inverse again. This one was dated, let's see, where is it? Oh, there we go. May 2nd, 2020. That was a little bit hard to see. They have different text, which I kind of like. It's different. I like that. So anyway, estimates for a coronavirus vaccine hover around an estimated 18 months. So here we go. We're going to talk a little bit about vaccines. I'm just going to tell you a little bit about the different types of vaccines and what vaccines are currently in work. Weakened or inactive coronavirus vaccines. These use weakened or dead versions of the virus to train the body to recognize a pathogen. So that's one type, but the coronavirus vaccines aren't typically focusing on that type of vaccine. I've seen a lot of nucleic acid vaccines, which is the next one they list. These vaccines deliver part of the virus's genetic material into the body. This gives your cells instructions to make parts of the virus. Then the immune system learns to fight it off. So that's a nucleic acid vaccine. Viral vector vaccines. This approach involves hijacking another type virus, which knows how to enter a cell, and genetically engineering it to produce coronavirus genetic material. So that's another one that's definitely been focused on right now, and it's a pretty smart technique. Basically, you can take a cold virus, for instance, and extract the DNA from the cold virus and inject a genetically engineered code or sequence to produce coronavirus's genetic material, and just a small part of it. So it's just a small part that would allow your immune system to recognize the full DNA or RNA of coronavirus. And in that way, your immune cells and your T cells will then be able to recognize it. And that is a very good thing. The next one is subunit vaccines. These vaccines teach the body to recognize a specific portion of a virus, like the spike protein on the coronavirus, which allows it to enter the cells. These often require the use of adjunct agents that can boost the vaccine's effectiveness. So here are 5 candidates that are being tested in humans right now. This list is not exhaustive, but these are in either phase 1 or phase 2 out of the 3 phases needed to make a vaccine. So here are the ones that are more close to getting complete. One is CanSino's AD5-NCoV. Who's behind it? CanSino Biologics Inc. is a biotechnology company based in China. They're collaborating with the Academy of Military Medical Service Institute of Biotechnology, also based in China. The types of vaccine. Viral vector vaccine. This virus takes a common adenovirus, common viruses that cause cold-like symptoms, and hijacks it to make the coronavirus spike protein. The adenovirus uses the protein to latch onto cells and infect them. Ultimately, this vaccine attempts to teach the body how to fight that latching off. That's a kind of like a hybrid of a subunit vaccine that is working on the spike protein and a viral vector vaccine. That's pretty smart of them, actually, because it's just recognizing the actual spike protein. You don't even have to have the DNA already have been being injected by the actual coronavirus. It can just simply, your cells can just simply see the outside of the coronavirus and recognize the outside itself. So that's pretty smart if you ask me. And actually, though there's been a lot of flack on China, they also have a very advanced, biotechnology sector there. So, I'm not going to get into any conspiracy theories. Like, I'm not a conspiracy theorist, but if you're one of those people who thinks that maybe it got leaked from a lab, and I'm a scientist, I'm not going to rule any possibility out. At least they have a pretty brilliant way on how to fix it as well. So anyway, the timeline they've completed, this particular vaccine has completed phase 1 clinical trial. And it's currently recruiting for phase 2 clinical trial that will begin soon. Okay. So the next vaccine is called Moderna's Mrna 1273. Who's behind it? Madonna Inc. It's a biotechnology firm based in Cambridge, Massachusetts. The company received $438 million from the Federal Biomedical Advanced Development Authority, part of the U.S. Department of Health and Human Services, to develop the vaccine. Well, it's nice to see the U.S. funding some biotech for once. We need a lot more of that in the future, if there is one. Okay, type of vaccine. This vaccine is a nucleic acid vaccine, specifically an mRNA vaccine, so messenger RNA. No vaccine of this type has ever been approved by the FDA, since these vaccines can be made very fast. The timeline, the company's promised one of the fastest vaccine development timelines there are. And I wonder if maybe because mRNA is such a small molecule, or maybe slightly unstable molecule, because RNA itself is such an unstable molecule, that's why one has never been approved, is because by the time RNA would decay so quickly within a matter of 2 or 3 days tops, and it decays so quickly in general that this is why we don't use typically RNA evidence in criminal cases. We only, or forensics, we typically look at DNA, because DNA can last such a much longer time. It's a much more stable molecule. RNA is very unstable. It doesn't last very long. So wherever the vaccine is made, it would have to be distributed like right next door. It would have to be the hospitals next door. It would have to be the hospitals, down the road, basically, in order for it to, get to people in time before it would decay. So the phase 1 clinical trial is underway. The release also states that the phase 3 study could begin in fall 2020. This is the outlook. Scientists at the NIAID and the Madonna are able to move quickly because their work is informed by past research on SARS and MERS. So that's good. At least they're, they have lots of data underneath their feet that they're able to use. That's cool. But I'm pretty skeptical of that type of, or any type of mRNA or RNA-based vaccine for the reasons I gave. So anyway, next, Inovio's INO 4800. Who's behind it? Inovio Pharmaceuticals is a company focused on DNA-based vaccines in Plymouth Meeting, Pennsylvania. Type of vaccines. Or type of vaccine, that is. It's a nucleic acid vaccine. This vaccine gives the body genetic instructions to create extra antibodies that know how to destroy the coronavirus. Inovio is also working on an accompanying device called the Selectra 3PSP, which can open pores within cells and help that genetic material slip inside. These devices are necessary to make sure these vaccines are as effective as they can be. The timeline: on April 6, Inovio began a phase 1 clinical trial on 40 volunteers. The results from that trial are expected by late summer, the company's website reads. Phase 2 clinical trials are expected by the fall of 2020. Assuming all goes well, the plan is to produce 1 million doses of the vaccine by the end of 2020. The outlook is the vaccine is still progressing quickly, but hasn't committed to as rapid a schedule as Moderna's mRNA 1273. Still, the company is investing in producing it on mass scale by partnering with Richter Helm Biologistics. The concern is that working on both a vaccine and a device could slow them down. Still, again, much better than an mRNA vaccine. The next one is the Ep.1 nCoV-19, or the Oxford vaccine. Who's behind it? Well, this vaccine is being developed at the Jenner Institute at the University of Oxford. That makes it one of the few vaccines not being investigated by a big biopharma company. Type of vaccine is a viral vector. This vaccine also sneaks into the coronavirus genetic material using the adenovirus. The timeline. This vaccine is already in a large phase 1 clinical trial. Ooh, this is good. The team has already given the vaccine to 320 people and aims to have it given to 1,102 people by the end of the first trial, according to the Jenner Institute's website. However, the New York Times reports that the group plans to test their vaccine on more than 6,000 people by June. Pending regulatory approval, the positive results, the vaccine could be available by September. Holy smokes, that's so fast. Anyway, the outlook. This vaccine has already shown positive results in rhesus macaws. Oh, it's a type of macaws or bird. It's a bird. But I know I'm pronouncing that wrong. Who received a heavy dose of virus, followed up with the Oxford vaccine at the Rocky Mountain Institute and NIH lab in Montana. The macaws remained healthy after 28 days. According to the New York Times, this research has not been published in a peer-reviewed journal. However, human trials are still ongoing, but adenovirus-based vaccines are well researched and have been trialed as potentially Ebola vaccines as well. The group is already working on scaling up production and has signaled an agreement with AstraZeneca to manufacture the vaccine if it works. If it does come to fruition by September, it will be miles ahead of other candidates. Pretty impressive. Okay. So there's a few more, I think, or maybe just one more vaccine here. It's Sinovac's Picovac. That's a tongue twister. Sinovac's Picovac. Who's behind it? Sinovac Biotech Ltd. is a China-based company, but they've partnered with the Berkeley, California company Dynavax to make a vaccine. Dynavax will provide an adjunct, an agent intended to make the vaccine elicit a stronger immune response. Type of vaccine. An inactive form of SARS-CoV-2. This type of vaccine requires a lot of safety testing, but scientists have been making them for decades. The timeline. A clinical trial on this vaccine began in China on April 16th and will enroll 114 participants in the first phase. The plan to enroll 744 participants in a phase 2 trial conducted simultaneously is unclear when the company plans to have a vaccine completed. The outlook. A non-peer-reviewed test of this vaccine in April in macaws suggests that the vaccine could offer complete protection from the virus, but results from human trials are awaited. Inactive vaccines are an old school approach, which means that we have the infrastructure to make them. These vaccines are also fragile and need to be kept in temperature controlled storage. Thousands of shots have already been produced, just in case it works. As long as we don't cut scientific corners, Fox says, a vaccine might be coming relatively soon. If this much funding and political will was focused on any disease, you would expect to see a lot of rapid progress, he says. So anyway, it looks like these, the most promising, in my opinion, would be the one being developed by Jenner Institute, the University of Oxford. So that is pretty interesting. And, you know, for people who are worried about their health and, you know, thinking about, oh, well, you know, which vaccine would be, you know, more thorough, it seems like the last two. But I have always been a little bit wary of vaccines that contain a dead virus, just in case, like, you never know, one might be alive. But it's a very thorough process. So really, it's just more of my paranoia than anything. It's not very logical with me. But however, for, just extra safety, or if, people have researched that and they're concerned about that. Like, oh, what if it's alive? They just, look at who's making the vaccine, learn about and remember the types of vaccines, and learn more about viruses and how they work and how vaccines work, learn about the polio vaccine and Jonas Salk. That's a very good example. Learn about measles. There are many types of very highly contagious, very deadly diseases that are easily prevented by vaccines. And we've also, like they said, we've moved away from that old school method traditionally of using, a dead virus or, a moot portion, of the virus as a vaccine. But, it does make sense that that type of vaccine would be very thorough, because it would be the whole entirety of the virus, right? Wouldn't it? So your immune cells would be able to recognize everything in it. The DNA, the outside shell, the components, everything that would make up that virus would be in that type of vaccine. So as long as we don't cut corners, as they say, as long as we're thorough, we can make very, very safe vaccines for coronavirus that would protect you 100% and your loved ones from a very deadly disease. So I'm looking forward to this Oxford one. It seems to be the one that's getting out fastest anyway. So that's good news. It's a viral vector vaccine, so it'd be pretty darn thorough. It would be, I would definitely get that one. So me personally, the RNA one, not so much. And I would even consider, the first one, the one that was based in China. I do believe in scientists and I believe in science. So this is also a viral vector vaccine, and it looks very promising. So anyway, but the one from Oxford would be closer. It wouldn't have to be shipped so far. So that one will probably be, I'm really thinking that's going to be the main vaccine that the citizens of the United States will end up getting. It makes the most sense. It's closer to home. It's the safest, type of vaccine you can possibly imagine. It uses an intelligent method of delivery too. So, and it would be very thorough. So anyway, my next point is, after reading the stuff about the cats and the, stuff we just read, is just some, pretty simple news from the BBC that the coronavirus may never go away. And that's probably very true. If it's infected so many other animals, so many other species, it seems like it's going to be, endemic every year. It's concerning. It really is, because it seems to have a pretty high mutation rate. But we'll get into that in another video. We'll go very thoroughly into how viruses mutate, how they propagate. We'll get into all the numbers and the math there as well. Hopefully that one will be a very interesting episode for you guys, and that's going to be the same episode where I talk about cancers and viruses. So I hope you guys make sure to remember to tune in for that later episode. So here it says this was released May 14th. And it says, whoops, I just clicked off real quick. Anyway, that it says that basically it's going to be around for a long time. And then the next one is coronavirus, will never go away if clusters of anti-vaxxers oppose a vaccine. So this is why I'll be doing a big, lengthy episode on vaccines. I'll actually just do a whole history of vaccines, history of how vaccines have become safer over time, and how they work, because I think a lot of fear is based in just not knowing. And we fear what we don't know. We fear the unknown, naturally, as humans. Many of us do. But that's why sometimes it's good to embrace the unknown, right? It's good to embrace learning the pursuit of knowing the unknown. And that's part of the reason why I love science so much. So let's just read a little bit of this. In November 2019, before the world had even heard of the novel coronavirus, 14 children on the Pacific island nation of Samoa were hooked up to ventilators. They were each fighting for their lives against a different but also highly infectious viral disease, the measles. During that outbreak, 81 Samoans died, and they were all deaths that could have been prevented with a safe and effective vaccine. It's this antidote, among so many others, of people who've died because they opted not to get their recommended shots, that has the World Health Organization worried that we may never get rid of coronavirus, even when there is a vaccine. I don't think anyone can predict when or if this disease will disappear, says the WHO's Executive Director of Health Emergencies, Mike Ryan, during a press conference on Wednesday. We do have one great hope. If we do find a highly effective vaccine that we can distribute to everyone who needs it in the world, we may have a shot at eliminating this virus, but that vaccine will have to be available. It'll have to be highly effective. It will have to be made available to everyone, and we will have to use it. So it's kind of a long article, but it shows people talking about, oh, coronavirus is a hoax, pictures. We've been seeing that all over the news. And the only way we can really reach people who, are conspiracy theorists and think everything is a hoax is to, maybe help teach them. And some may be unteachable, and that's okay. But we can do our best. We can definitely do our best. And I hope that in the coming episodes, I will do my best as well, since I'm just getting the hang of this. Anyway, guys, it has been really wonderful doing this episode. Again, it is my first episode, so it maybe had some bumps here and there. But I hope that in the future we can learn together, we can laugh together, and we can have a good time learning and enjoying the process of learning, because there might even be times that you learn with me, and that is probably going to be the funnest. So please make sure to subscribe to my YouTube channel, ring the bell, of course, all that jazz. And also maybe follow me on Twitter. My handle is at RT Science Wonder. The at stands for A, so Art Science Wonder. Would love some followers on there, because it feels lonely out there on the Twitterverse right now. And yeah, I would really love to be able to talk to you guys sometimes, maybe get some feedback, or just some things that you guys want to talk about intellectually, about science, about art, history, philosophy. I love all of those topics, and I'm definitely not antisocial. I tend to get very enthralled and into many topics and projects. So but I do want to talk to people, and mostly I'm not interested in arguing and constantly debating and stuff. I'm more interested in people who are interested in learning, and who love and are passionate about and enjoy the process of learning. That to me is the funnest thing ever. And if you have questions, or if you want to talk about a particular topic, I can at least get, that spark, that idea, or that interest, in that topic, if I'm not already interested, because I tend to be very curious. So, yeah. And make sure to follow Radical Science News as well. Radical Science News has a YouTube as well. So, we're on YouTube. We'll have all our podcasts that are specific to radical science there. And for Art Science Wonder, I do plan on eventually bringing on guests, figuring out this issue I've been having with my camera so that you guys can see me again, and doing a whole lot with Art Science Wonder, because that's my more broad platform. I can feel like I can talk about anything, pretty much from art, technology, science, economics, politics, whatever you guys want to talk about with Art Science Wonder. There's really not very much that would be left off the table, as long as it's something intellectual and thoughtful. So anyway, thank you all so much for listening, and until next time, bye.